I'll begin by washing my hands, coming over and introducing myself and identifying the patient. I'll go ahead and get some clean gloves on so that I can inspect his trachea. I'll remove the oxygen and lift up to check for any secretions and skin integrity. And after I've done that, I will replace the oxygen and I will turn the oxygen up and check for the suctioning. Sounds like it's good. I will then remove my gloves and I'll make sure this is a clean and sterile environment. Open this container, making sure that I do not touch the inside. And I will grab some saline, check the date, make sure it isn't expired, and pour away from the label, and I can fill up my little container. I'll leave it uncapped. Grab my gloves. Begin by gloving my dominant hand. Hopefully this works. I'll grab the cuff, glove my left hand. Okay, both of my hands are sterile. I can grab the suctioning equipment. Okay. I'll be wanting to use my dominant hand, so I'll wrap it up here with my right hand. So everything so far is sterile. I will come over and grab the hose. As soon as I do, my left hand is now contaminated. I will attach the tube. And before this, I would have measured from the bottom of his chin to the middle of his sternum, and hopefully it'll be about 16 to 20 centimeters. So after I've done this, I'll go ahead and check the suctioning and drain the hose. So after I've done that, I will come over to the patient and tell him that we're going to begin his procedure. I will remove the oxygen and insert the suctioning without covering the suctioning hole. And I will insert it up to about those 16 centimeters, which is right about there. As I've reached 16 centimeters, I will close the suctioning with my left thumb and begin to pull out. And after I've pulled out the suctioning, I will recap his oxygen, come over and clean out the tubing. And I'll wait for 1 minute for the patient to, so that he can become oxygenated again. After I've waited 1 minute, I will come over and tell the patient that we're going to suction his trachea one more time. Remove the oxygen, and again insert without covering the suctioning hole. And I will go down to the 16 centimeters. And as I've reached 16, I will cover the suctioning hole and begin to pull out very slowly in a circle pattern. And I'll come back over, and I will cover his oxygen. And suction the hose. Now I can come back and turn off the suctioning machine. Discard this equipment. And I can now turn down the oxygen, and now I will auscultate his lungs to make sure that he has normal breathing respirations. And after that, I'm all done, and I'll clean up my area.